So we've been asked the question, what is the dangers of getting off Suboxone? And it's a great question because, of course, there's an awful lot of people who are taking Suboxone as a form of medication-assisted treatment, or MAT. And Suboxone is a very good treatment for people who have opioid dependence. First, what is Suboxone? Well, it's a form of MAT, and it's a partial agonist. So it goes to the opioid receptors and it turns the switch on partially. But it's very long acting, so it doesn't give you a spike in dopamine, and so it doesn't really get you high. It just fills up the receptors and helps take away cravings. But bigger than that, it helps prevent overdoses, because once the receptors are full of this drug Suboxone, which binds very tightly, if people use heroin or what is most commonly used these days as fentanyl, it really can't have much effect, and so it's almost impossible to overdose if you're on Suboxone. And so it's a very effective form of medication-assisted treatment. Of course, we've specialized over the years in naltrexone as a different form of MAT, and that's a complete antagonist or a complete blocker, and we like that and our patients like that. So some patients prefer Suboxone MAT, others prefer naltrexone. So what's the danger of getting off Suboxone? Well, first of all, it's pretty difficult to get off of it. It's not so much dangerous, like life-threatening to get off of it, but it's really difficult. The standard way of getting off it is to wean it down slowly, but that's so difficult that almost nobody actually completes it. They start having withdrawal symptoms and it goes on and on and on forever, and they end up finding that even after a year and a half or 2 years, they're still on it. So we've come up with an 8-day detox to get people off the Suboxone by giving them actually small doses of naltrexone to get them through the process quicker, and that works well. But the bigger problem with getting off Suboxone is the risk of relapse if you don't go on some other form of MAT. So what I mean by that is, if Suboxone's been working well for you, it's keeping you alive and keeping you from having cravings and preventing you from having an overdose if you do mess up. If you stop that and you're not ready to be off of it, then you're putting yourself at risk. And last year, 2021, there were 100,000 people who died of a drug overdose, which is insanely huge, almost twice as many as died in the whole Vietnam War. And when people go off Suboxone, they put themselves at that risk, because fentanyl is the drug that's being used on the street, and it's highly dangerous, and it causes overdoses so quickly and so easily that you really shouldn't go off Suboxone until you're ready, until your providers, the doctors, the counselors working with you all agree that you're ready to go off of that. And how do we know that? Well, you want somebody who's not using other drugs, they're working a program, going to their support groups, 12-step meetings, rational recovery, they're in counseling, their marriage is stable, their relationships are stable, they've got a good job, they're not hanging around with people who are still using drugs and alcohol. In other words, they've really changed, they're in good long-term recovery. Then they're probably ready to come off Suboxone. But we always highly, highly recommend that they go off the Suboxone and then go on the naltrexone MAT for at least 12 months, so that they then have the experience of being off of everything before they stop using their MAT. So hopefully that's helpful information. If you have any questions, please let us know.